Have you ever wondered why doctors, dietitians, and even health magazines urge us to eat more leafy greens? Kale, spinach, lettuce, collards, and Swiss chard have become almost synonymous with healthy eating. But what does the scientific evidence really say about leafy greens and heart disease? Today, we'll delve into the research, quote actual studies from reputable institutions, and explore both the benefits and the limitations of leafy greens for heart health. Heart disease remains the leading cause of death worldwide. According to global health statistics, cardiovascular diseases account for nearly 18 million deaths each year, more than any form of cancer, respiratory disease, or infectious illness combined. With such a heavy toll, even modest improvements in diet could translate into millions of lives saved. Let's begin with the most direct evidence connecting leafy greens to heart outcomes. A landmark long-term investigation, part of both the nurses' health study and the health professionals' follow-up study, tracked tens of thousands of adults over many years to see how diet relates to heart disease. When scientists compared people who ate the highest amounts of fruits and vegetables to those with the lowest intake, they found a striking pattern. Individuals with the highest consumption had a 20% lower risk of coronary heart disease than those in the lowest group. Importantly, the greatest protective effect came from green leafy vegetables in particular, with each daily serving linked to a noticeably lower risk. In numerical terms, this study found that each additional serving of fruits or vegetables per day was associated with a 4% lower risk for coronary heart disease, and that green leafy vegetables had among the strongest individual protective associations. So, how do greens exert these effects? The answer lies in multiple biological mechanisms. Leafy greens are rich in nitrates, micronutrients that are converted in the body into nitric oxide, a signaling molecule that helps blood vessels relax and widen. This vasodilation reduces blood pressure, a major risk factor for heart disease and stroke. A major study conducted in Denmark, involving more than 50,000 adults over a 23-year period, showed that people who consumed the highest quantities of nitrate-rich vegetables, especially leafy greens like arugula, spinach, and lettuce, had about a 12% to 26% lower risk of cardiovascular disease when compared with those who consumed the least. These same individuals also had lower systolic blood pressure, about 2.5 millimeters of mercury, lower on average. Lead researcher Dr. Catherine Bondanno of Edith Cowan University emphasized, "Our results have shown that by simply eating 1 cup of raw or half a cup of cooked, nitrate-rich vegetables each day, people may be able to significantly reduce their risk of cardiovascular disease." Another mechanism pertains to vitamin K1, a nutrient abundant in leafy greens like spinach, kale, and broccoli. Vitamin K1 plays a role in regulating calcium in blood vessels, preventing it from depositing and contributing to arterial stiffening, a key contributor to atherosclerosis. Research from Australian scientists found that women with approximately 30% higher intakes of vitamin K1 had less thickening of blood vessel walls, a marker of cardiovascular disease. When nutrition researchers simply pool all the high-quality epidemiological evidence together, meta-analyses paint a consistent picture. Higher green leafy vegetable intake is associated with lower cardiovascular disease incidence. One such meta-analysis found that people with higher intakes had about a 15.8% reduced incidence of cardiovascular disease compared with those with lower intakes. Another pooled analysis spanning 17 studies also found that green leafy vegetable consumption was inversely related to incident cardiovascular disease events, including heart disease and stroke. Even after adjusting for other lifestyle factors, it's important to break down these numbers realistically. These are not dramatic reductions like a pharmaceutical drug might produce, but they are meaningful at a population level. A habitual habit as simple as a daily salad or an extra serving of greens with lunch can, over years and decades, tilt the odds modestly in your favor. But what about limitations? While the evidence is compelling, it also comes with caveats. First, most of the research linking leafy greens to heart health is observational, meaning it tracks large groups of people and how their diets correlate with health outcomes. This kind of study can show associations, but cannot prove causation. Factors like overall lifestyle, exercise, genetics, and socioeconomic status also influence these outcomes. Secondly, more is not always better. In the Danish long-term study, researchers noted that the benefits of nitrate-rich vegetables seemed to plateau at about 1 cup per day. Eating more did not confer proportionally greater protection. There are also specific populations where caution may be warranted. For example, people prone to kidney stones or those on medications affecting blood clotting, like warfarin, may need to monitor vitamin K intake and coordinate dietary changes with their health providers. On a practical and public health level, there's another problem. Not all plant-based foods are equal. A recent study published in The Lancet Regional Health emphasized that minimally processed plant foods, including fresh vegetables, provide protective effects, while ultra-processed plant-based foods do not and may even increase heart disease risk compared with whole food-based diets. So the key takeaway here is quality matters. A diet rich in fresh, whole leafy greens and other vegetables is far more beneficial than one of processed plant-based alternatives. If you're seeking real, achievable steps, aim for at least 1 cup of leafy greens daily, whether spinach on your morning eggs, a side salad at lunch, or sautéed kale with dinner. Variety matters. Combine nitrate-rich greens like arugula and spinach with cruciferous vegetables like kale and broccoli for complementary nutrients. Pair greens with healthy fats like olive oil, nuts, or avocado to enhance absorption of fat-soluble vitamins. Remember that greens are part of a lifestyle. Regular physical activity, smoking cessation, and overall balanced eating amplify these benefits. Conclusion. In summary, decades of research support a clear connection between a diet rich in leafy green vegetables and lower risk of heart disease, lower blood pressure, and better vascular health, with reductions in risk ranging from modest, 4% per daily serving, to more substantial, 12 to 26% lower risk in long-term cohorts. As with all nutrition science, it's not a magic bullet, but it is a powerful, evidence-based tool in the heart health toolkit. So the next time someone tells you to eat your greens, science is backing that advice, 1 cup at a time. The information presented in this video is for educational and informational purposes only, and is not intended as medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare professional or your physician with any questions you may have regarding a medical condition, medication, or dietary supplement. The views and opinions expressed are based on publicly available research and are not a substitute for professional medical guidance. Never disregard or delay seeking medical advice because of something you have heard or seen in this video. If you found the information in the video useful, please subscribe, like, and comment below in support of our channel so that we can bring you more information to better your health. Thank you.